American Indians are dying from COVID-19 at disproportionately high rates. According to a New York Times report, the loss of specifically tribal elders has caused a cultural crisis in many communities. That's because they are often responsible for passing on traditions and language to the next generation. For more on this, I want to bring in Abigail Echo-Hawk. She's the director of the Urban Indian Health Institute. Abigail, thanks for being with me. What is being lost with the passage of these tribal elders? Can you help our viewers understand that more?
Yeah, for American Indians and Alaska Natives, we know that we are dying at much higher rates. And in fact, a recent paper published by the CDC, in which I'm a co-author, found that we are 1.8 times more likely to die than non-Hispanic whites. When we lose these members of our communities, any member, but especially our tribal elders, they are the ones who are holding on to our culture and our traditions. And as a result of the ongoing colonization, the loss of our people through the purposeful genocide that happened to us upon, the first settlers on this land, our people, those elders hold knowledge that no one else has. Some of them are the very last language speakers. Some of them hold cultures and songs and ways of being that without them, we don't have a way to transfer those to the next generations. So we are doing everything we can to preserve our elders and to take the public health precautions needed to ensure that they are still here with us, and we mourn and we cry for those that we have already lost.
Abigail, even though people over the age of 65 are now eligible to receive the COVID-19 vaccine, many tribal elders are unable to access vaccination sites. What are these obstacles that they're facing?
We have extreme obstacles within Indian country, both in tribal and urban areas. So tribal lands, which many people know about, the reservations and villages across the United States. In addition to that, we know that approximately 70% of all Native people are living in large urban settings across the United States. So there are a lot of barriers. In our rural areas, we know that transportation is one of those. We just conducted a recent survey, my organization, and we found that 39% of the respondents had difficulty simply getting to a clinic. So if it's going to take you an hour and a half to get there, you got to get your vaccination, you got to pay for gas, then you go home, and 3 weeks later, you're expected to show up again. That transportation is a major, major issue. In addition to that, the consistent underfunding of the Indian Health Service, where there may not be proper providers, there may not be enough resources, is something that we battle every single day in both urban and rural American Indian Alaska Native healthcare. These obstacles all put together make it difficult for us to ensure our tribal elders get what they need. But right now, one of the things we know, our communities are actually leading in vaccinations. We are doing better than states and counties, and that's something the rest of the country can learn, is when we have the resources, and if we had more resources, we would be able to even reach more people.
I've reported and spoken with people at length about the problem of vaccine hesitancy and fear of the vaccine. How much of this is an issue in Native American communities, and what are you doing to combat that?
So my organization will be releasing tomorrow the very first national report on vaccine hesitancy and acceptance in Native communities. And we actually found in that survey that 74% of American Indians and Alaska Natives felt it was their responsibility to the community, to their tribe, and to the cultural preservation of our people to get vaccinated. So we actually have higher rates of people willing to get vaccinated than are in other populations of people. However, there is extreme mistrust in the federal government because of the historical terrible things that have happened to us, the way that we've been treated and mistreated and tested on. And so there are also extreme hesitancies. People want to know that these vaccines work. They want to know that other tribal leaders are participating and taking part in this. And they also want to know how they've been tested and if they're effective in our community. So we're still battling those hesitancies, but we know as a result of us being public health people, we always are here to take care of our community. We're making those choices based on how we want to take care of our community as a whole, and that's the way we're going to overcome this hesitancy.
Abigail, before I let you go, I'm wondering what more would you like to see done on a federal or local level, specifically to help Native Americans who have been impacted by COVID-19?
Right now, we need to see action taken by the Biden administration to properly fund the Indian Health Service to get the resources that are needed to our communities to combat COVID-19, increase of testing. One of the things my organization does with urban Indian communities across the nation is ask how much PPE they have, this equipment that is needed in order to serve people coming into the clinics. And we find that about a third of them have inadequate supplies. We are lacking that funding that needs to happen. And right now, the Biden administration has a responsibility to our treaty obligations and to fully fund the Indian Health Service to ensure that our people get what they need. Otherwise, we're going to keep watching our elders die.
All right, Abigail Echo-Hawk, thank you for joining me.
Thank you for having me.